New research shows many Americans with depression and anxiety feel mental health medication treatment is still one size fits all. Here to discuss why more patients are seeking personalized care and how genetic testing may help inform treatment decisions is board-certified psychiatrist Dr. Crystal Nelson. Thank you so much for joining us.
Thank you for having me.
In your opinion, why is personalization so important when it comes to mental health care?
Mental health care is highly individualized. What we know works for one person just simply may not work for another person, yet patients feel like their health care is one size fits all. In 2026, the GeneSight Mental Health Monitor Survey showed us that 88% of patients diagnosed with depression and or anxiety would feel more confident in their mental health care if it were more personalized. So we know that personalization really matters when we're talking about symptoms, side effects, treatment outcomes. We know that this can vary so significantly from one person to the next. So if we can begin to tailor and customize these treatment plans and have more informed conversations, we hopefully can get better treatment experiences.
Well, as most people know, it is really difficult to get that right medication combination, and this can involve a trial and error process that can go on weeks, months, sometimes even years. Can tools like GeneSight help with that?
Yes, absolutely. So we know that oftentimes it can be very frustrating, a long trial and error process for some patients. In that survey, we also saw that 13% of patients who had previously been treated, only 13% said that the first medication worked for them. So now we have an opportunity where we could use a simple cheek swab test like GeneSight, where a clinician can order this in their office and then get information back in a simple report, giving them information about how the person's genes might actually impact the medication outcomes, with the attempt to cut down on this trial and error process and create a really personalized approach.
If a patient's plan just simply is not working for them, what kind of conversation should they be having with their provider?
Well, a patient should hopefully always feel empowered to have an open and honest conversation with their clinician about if their medication is not working for them or the treatment plan is not being successful. But if a patient is uncomfortable, they could go to GeneSight.com and get a clinician discussion guide to start that conversation with their clinician, and hopefully that could create this conversation where if something like a pharmacogenetic test like GeneSight is appropriate, it could be ordered.
Where should people go for more resources, for more information, or to even get a look at this guide to help have this conversation?
Well, of course, they can start with their healthcare provider, but if that is not an option, they can simply go to GeneSight.com to get more information.
Thank you so much, Dr. Nelson. Great talking to you.
Thank you so much for having me.